In the same lane in Delhi, two stroke patients came home from hospital on the same day. Both had weakness on the right side. Both needed help to sit and stand. Both families were scared and confused. 6 months later, one man can walk slowly with a stick inside his house. He can hold a spoon and eat without help. He can say clear, short sentences to his grandchildren. The other man is still lying on a bed in the living room. His hand remains tightly closed. His leg hardly moves. Every small task still depends on his wife and children. The brain scans of these two men looked almost the same in the beginning. The medicines were almost the same. The difference is not magic. The difference is how their brains were trained at home. One family used neuroplasticity in the right way. The other family unknowingly trained the brain in the wrong direction. My name is Doctor Heartwise. I am a cardiologist. On this channel, we talk honestly about stroke and heart disease in India so that you can protect your family through real science, not myths. Today, I will show you how to speed up stroke recovery by using neuroplasticity correctly and how to avoid 5 common mistakes that silently slow down or even reverse recovery. If someone in your family is recovering from stroke, press like now so that this message reaches more Indian families. Subscribe to the channel and turn on the bell so you do not miss the next part of this stroke series. In the comments, write your city and how many months it has been since the stroke. Your answers help me decide what to explain next. Let us start with a simple but powerful idea. Your brain is not a fixed stone. It is more like wet clay that can be shaped and reshaped. Neuro means brain. Plasticity means the ability to change shape. Neuroplasticity is the amazing capacity of the brain to form new connections and build new pathways. This is how a child learns to walk and talk. This is also how an adult brain can learn again after a stroke. Many families in India believe that recovery happens only in the first 3 to 6 months or at most 1 year and then stops forever. This is not true. It is true that neuroplasticity is highest and fastest in the first months after stroke. In this period, the brain is like soft clay that responds quickly to training. After that, the speed becomes slower, but the ability to learn never becomes zero. The brain can change at any age if we stimulate it in the right way. However, this brain plasticity can move in 2 directions. There is positive neuroplasticity when we train the weak side correctly with the right movements and repetition. There is also negative neuroplasticity when we repeat wrong patterns and the brain learns those instead. If the patient always uses only the good hand and never tries the weak hand, the brain learns that the weak hand is useless. If the leg stays bent all day, the brain learns that bent is the normal position. This is why some patients become more stiff instead of more free as months go by. Now I want to show you 5 common mistakes that destroy positive neuroplasticity after stroke. Listen carefully and check honestly whether any of these are happening in your home. Mistake number 1: believing that recovery has stopped and giving up. Many patients and families hear someone say that after 6 or 12 months, nothing more can improve. They reduce exercises. They stop going for therapy. They accept the current level as final. The brain receives a clear message. Training is over. There is nothing new to learn. As a result, even the small gains that were there become weak and stiff again. The truth is different. The big gains usually come early, but smaller gains can still come for years with correct practice. If you treat the recovery window as closed, you lock the patient into the present condition. If you keep stimulating the brain with meaningful challenges, you give it a reason to keep building new connections. Mistake number 2: treating stroke like a bone or muscle problem. Many families start strength exercises with weights or resistance bands before there is proper movement. They ask the patient to hold a dumbbell or a heavy bottle in the weak hand and try to lift it. They think more weight means faster progress. In reality, the brain is still struggling to send the basic movement signal. Adding weight only makes the pattern more clumsy and frustrating. Stroke is first a wiring problem, not a pure strength problem. Movement must come before muscle power. Mistake number 3: using the good side to do all the work. This is one of the most common hidden enemies of recovery. For example, the right arm is weak after stroke. To raise it, the family lifts the arm with the left hand. They hold it up and then drop it again. Everyone feels happy that the arm is moving. In reality, the brain is hardly working on the weak side. The strong side is doing everything. The brain learns that when help is needed, the good hand will rescue. The weak hand remains silent and the map of that hand inside the brain becomes smaller and smaller. The same happens with the leg. Family members drag the leg forward while walking instead of giving the patient time to try to move it. This looks kind from outside, but it steals chances for the brain to practice. Mistake number 4. Repeating only easy or partial movements. A classic example is the squeeze ball. Imagine the hand is mostly closed. Relatives give a soft ball and ask the patient to press it again and again for days and weeks. Pressing is a closing movement. There is no focus on opening the hand. So the brain becomes very good at closing and worse at opening. Flexor muscles become strong and tight, while extensor muscles remain weak. The hand becomes a stiff fist that is hard to clean and almost impossible to use. The same idea applies to other joints. If you repeatedly practice only the movement that already exists, the brain strengthens that pattern and ignores the missing part. Neuroplasticity is happening, but in the wrong direction. Mistake number 5. Ignoring invisible problems of the mind and body. Anxiety, depression, fear, poor sleep and exhaustion are not always visible like a paralyzed arm, but they strongly affect brain learning. A patient who hears all day that he is weak or useless soon loses motivation to try. A patient who sleeps badly and has high blood pressure and uncontrolled sugar will have low energy and limited ability to focus on exercises. Families sometimes laugh at the patient when he struggles or scold him for not trying hard enough. These words cut into the brain and kill hope. Without emotional safety, neuroplasticity becomes much harder. Now that you know these mistakes, let us switch to the solution side. I will give you 5 rules to boost neuroplasticity and speed up recovery in a safe and realistic way. Think of these rules as a daily prescription for the brain. Rule number 1. Train movement before strength. The first target is to wake up the weak side and rebuild basic patterns. For the arm, this means practice of reaching, opening, closing, and placing the hand on objects with help from a therapist or trained relative. For the leg, this means weight shifting, standing balance, and controlled steps with support. Only after a movement is present in some form do we slowly add resistance. The brain first learns the path. Then the muscles learn to walk that path with power. Rule number 2. Challenge the brain with specific goals every day. Neuroplasticity grows when the brain faces a clear challenge that is not too easy and not impossible. Instead of random movements, set small targets. Today we will practice opening the fingers of the right hand 10 times with guidance. Today we will stand for 30 seconds with support at the kitchen counter. Write these goals on paper. Count the repetitions. When the brain succeeds, it gets a strong message that this pathway is useful and worth strengthening. Rule number 3. Balance both sides of each movement. For every movement that closes, there must also be practice for opening. If the elbow bends, it must also learn to straighten. If the knee bends to sit, it must also straighten to stand. Ask yourself during the day which movements we are practicing more. If you see that only gripping or only bending is being repeated, you must add tasks that train the opposite action. Balanced practice prevents stiffness and builds more natural function. Rule number 4. Train the brain, not only the muscles. Remember that stroke is a wiring problem, so mental tasks are also brain exercises. Encourage the patient to count repetitions aloud if speech is possible. Ask them to describe what they are doing. Name the objects in the room. Play simple board games or sorting games that require attention and planning. Even listening carefully to instructions and then repeating them is training for brain pathways. Physical and mental practice together create stronger networks than physical work alone. Rule number 5. Protect the environment in which the brain is trying to heal. This includes mood, sleep, and basic health. Speak to the patient with respect. Praise effort, not only results. Say, "We saw you trying very hard today and that matters." If you notice sadness, fear, or refusal to engage in any activity, talk to the doctor. Post-stroke depression is common and treatable. Make sure blood pressure, sugar, and other risk factors are well controlled. Provide a regular sleep schedule and avoid late-night television or loud noise around the patient. A calm, stable body and mind give the brain the best chance to use neuroplasticity. If these rules make sense to you, and you want to protect the recovery window, press like on this video so that YouTube can show it to more families in India who are feeling lost after stroke. In the comments, tell me honestly which mistake you see most often in your own home. Is it using the good hand for everything, or pushing heavy weights too early, or only squeezing a ball? Writing it down is the first step to changing it. Now let me compress this lesson into a short checklist you can remember. Stroke recovery depends heavily on neuroplasticity. Neuroplasticity never stops, but it is strongest in the first months. Wrong training can create negative plasticity. To support positive plasticity, you must train movement before strength, set clear challenges, balance closing and opening, use mental activities, and protect mood and health. Every repetition you do in the right way is like a message to the brain. This movement matters. Please save it. Every repetition you do in the wrong way sends the opposite message. This movement is not needed. You can forget it. Your daily routine decides which message the brain hears more often. Stroke recovery in India is not only about hospitals and injections, it is also about what happens each hour in the bedroom and living room after discharge. Families who understand neuroplasticity and respect it can pull their loved ones upward on the staircase of recovery. Families who ignore it may leave the patient stuck on the first few steps for years. This is Dr. Heartwise. My work is to give you clear science and practical steps so that your family can avoid regret later. If you have not yet subscribed, press subscribe now and turn on all notifications. Share this video with at least 2 people who are caring for a stroke patient at home. Together we can change how India thinks about stroke recovery. Thank you for watching and I will see you in the next video.